San Francisco is really one of a few cities, and probably really the only city, that is dedicated to transforming all of its public housing stock. Just from a pure perspective of history, we have this moment in time to collect data in a way that hasn't been collected before. It's this really opportunistic time to be able to tell the story about what happened in San Francisco and also how practitioners can learn from that. Hi, my name is Susan Neufeld, and I work at Bridge Housing, and I'm the community partner for Team San Francisco in Cohort One.
So our research focuses on public housing residents and the renovation of public housing spaces. We know that here in San Francisco that the public housing stock has been neglected for 40 years.
The renovations are being funded by a federal policy out of Housing and Urban Development called the Rental Assistance Demonstration Program, RAD. It's a way to get public housing funding combined with private developer funding.
Taking the onus off this housing authority and allowing private developers to essentially come in and take over management of the public housing stock through the Rental Assistance Demonstration Program.
So we're looking at the health and social effects of the renovation for the RAD residents in 7 locations in San Francisco.
We're looking at how the rehabilitation of public housing improves people's overall health, their experience of their own health, and then how they may or may not be using healthcare systems.
We're finding the medical records for the people living in the public housing locations through linking through the addresses of the public housing locations. We're pulling out the medical appointments, the emergency room visits, the hospitalizations for them, and then we're looking at the diagnosis codes.
And then also collecting a lot of qualitative data to understand how people think about the renovation, both good and bad.
Public housing in San Francisco is aged, old. It's falling down, falling apart. I mean, there's roof problems, electrical, there's mold, there's situations that need to be attended to, and we know it.
Listening to the feedback from residents is really important for us to learn how to minimize the disruption and some of the harm that can happen when you do this work, particularly because we're going to continue to do these types of public housing transformation projects.
The new developers, and Bridge being one of them, in addition to renovating their units, is providing them connections to services or access to services. So we want to know if they're getting the services they need, if the upgrades are supporting their lives going forward.
Look, public housing has always been a huge investment, and this is one of the first steps in order for us to figure out, here's a return on investment. If we can show that health impacts change as a result of public housing.
And we are committed to making sure that not only Bridge Housing, the developer in the locations where we're talking to people, but also other housing developers who are working on RAD properties in San Francisco and in other locations, hear about the residents' experiences going through these renovations.
How this very large financial investment from the city, from HUD, from others, how that could potentially save money on the back end when it comes to healthcare systems or other social service systems. And I think that that's important because a lot of people question how much money that we're putting into public housing transformation, and it'd be nice to show that it's taxpayer money well spent. As practitioners, we certainly like to be informed with research. It's not very often we're invited to participate in research and to have an equal voice in how research is shaped.
You find a voice that you may not have had before, and you use it a lot. And so you keep pushing those boundaries a little bit. And I think I have to credit IRL for that.
I think research leader is really anyone who's curious about studying and understanding their community in any sort of rigorous way.
In a culture of health, everyone will have equal access to the resources for education, training, work, and medical care.
In a culture of health, people have access to the resources and supports they need to be happy.
In a culture of health, all people live in housing that is healthy, that is safe, and that adds to their abilities to live their dreams, raise their families, and reach the potentials that they should.
Never give up. Never give up. Don't you never give up. Don't you never give up. Don't you never give up.